This is All India Radio. We now bring you a special program on COVID-19. Good evening. I'm Tanvi Taneja and with me is R.S. Raghu. The headlines. Prime Minister Narendra Modi holds comprehensive meeting to discuss strategies to attract more foreign investments into the country. Health Ministry says recovery rate of COVID-19 cases has improved to above 25%. Doubling rate slows down to 11 days. Government says new guidelines to fight COVID-19 to come into effect from 4th of May, with some relaxations in many districts. World Health Organization to convene an emergency meeting on coronavirus today. And Heavy Industries and Public Enterprises Minister Prakash Javadekar discusses the impact of COVID-19 on the automobile sector. Prime Minister Narendra Modi has directed all concerned for a more proactive approach to handhold the investors, to look into their problems and help them in getting all the necessary central and state clearances in a time-bound manner. Mr. Modi held a comprehensive meeting in Delhi today to discuss the strategies to attract more foreign investments into the country. The meeting also focused on promoting local investments and boosting the economy against the backdrop of COVID-19 pandemic. It was discussed that a scheme should be developed to promote plug and play infrastructure in the existing industrial lands, plots and estates in the country and provide necessary financial support. The meeting was attended by the Finance Minister, the Home Minister, Minister for Commerce and Industries and senior officials. A total of 1,718 new cases have been reported in the last 24 hours, taking the total number of COVID-19 cases to 33,050. Briefing media in New Delhi today, a Health Ministry official said recovery rate has improved from 13.06% to above 25% in 14 days.
हमारे देश में टोटल रिकवरी रेट प्रेजेंटली 25.19% है। रिकवरी रेट के अंदर हम एक प्रोग्रेसिव ट्रेंड ऑब्जर्व कर रहे हैं। जैसे कि आप लोगों को इससे पहले भी बताया है कि 14 दिन पहले का अगर रिकवरी रेट देखें तो वह 13.06% था, जो कि अब बढ़कर 25% के ऊपर पहुंच गया है। यह एक बहुत ही पॉजिटिव साइन है।
The doubling rate of novel coronavirus is now 11 days compared to 3.4 days before lockdown. 67 deaths and 630 recoveries have occurred in the past 24 hours. A total of 8,324 patients, which is 25.19% of total cases, have recovered so far. 23,651 people are under active medical supervision. The official said a total of 49,800 RT-PCR tests have been done in the last 5 days, and only RT-PCR tests should be done as far as testing and treatment protocol is concerned. The Home Ministry official said Inter-Ministerial Central Team Hyderabad has found that implementation of lockdown and physical distancing is being done more or less well. The official said Home Ministry had yesterday permitted transport of stranded people like students, migrant labourers, tourists and pilgrims, but state governments must ensure these things before they transport such people.
गंतव्य पर पहुंचने के उपरांत स्थानीय स्वास्थ्य अधिकारी इन लोगों का मेडिकल चेकअप करेंगे। यदि इन्हें संस्थागत क्वारंटाइन की आवश्यकता नहीं प्रतीत होती है तो 14 दिन के लिए होम क्वारंटाइन में रखेंगे। नियमित रूप से इनका हेल्थ चेकअप किया जाएगा और इनके स्वास्थ्य पर नजर रखी जाएगी। यात्रियों को आरोग्य सेतु ऐप का उपयोग करने के लिए प्रोत्साहित किया जाएगा। सभी राज्यों को इन सभी निर्देशों का सख्त अनुपालन करना होगा।
Health Minister Dr. Harshvardhan has said that the doubling rate of COVID-19 cases in the country has been showing regular improvement. Interacting with civil society organizations and NGOs through video conference, he said India was one of the first countries to prepare a strategy at national and international level, along with international organizations like WHO to tackle COVID-19.
Home Ministry has said that new guidelines to fight COVID-19 will come into effect from 4th of May, which shall give considerable relaxations to many districts. Home Ministry spokesperson said that details regarding this shall be communicated in the days to come. The ministry said yesterday held a comprehensive review meeting on the lockdown situation. There have been tremendous gains and improvement in the situation due to lockdown till now. Home Ministry spokesperson said to ensure that these gains are not squandered away, the lockdown guidelines should be strictly observed till 3rd May. Centre has asked states to ensure free movement of trucks and goods carriers, including empty trucks. In a letter to State Chief Secretaries, Union Home Secretary Ajay Bhalla said the local authorities must not insist on separate passes at interstate borders across the country. Referring to reports that at interstate borders in different parts of the country, the movement of trucks is not allowed freely and local authorities insist on separate passes, Mr. Bhalla, while citing earlier orders, reiterated that it is not required. In Madhya Pradesh, about 20,000 labourers stranded in other states have been brought back to the state so far. After conducting health checkups of all the labourers, they are being sent to their home districts. Around 1 lakh labourers of Madhya Pradesh are working in different states. Some of them have already returned to the state.
Additional Chief Secretary and in charge of the State Level Control Room, ICP Keshri, has told that about 7,000 labourers are being brought back from Rajasthan and 3,000 from Uttar Pradesh today. Action is also being taken to bring back 1,600 labourers from Goa. Bhaiyalal Lohani of Umaria District and Nawal Adivasi of Shiopur District thanked the government for bringing them back from Rajasthan.
डोडर के रहने वाले हैं, नागौर जिले में फंसे हुए थे और बसों द्वारा निकाले हैं, उसके लिए हमारे मुख्यमंत्री जी को हम धन्यवाद देते हैं और जो खाने की प्रबंध किया है उसको भी हम धन्यवाद करते हैं.
On the other hand, under MG Narega scheme, more than 97,000 employment-oriented works are being conducted in more than 22,000 panchayats of the state. Of these, 7,24,000 labourers are being provided employment. Additional Chief Secretary Panchayat and Rural Development Manoj Srivastav said that instructions have been given to all the districts to start employment-oriented work in the remaining districts except hotspots. Sanjeev Sharma, AIR News, Bhopal.
In Jammu and Kashmir, the administration has facilitated return of 17,000 labourers, students and other people from different parts of the country. Those brought back were kept in administrative quarantine as per protocol. More from our correspondent.
The stranded residents were brought back from Punjab, Himachal Pradesh and Rajasthan. Among them, around 9,000 persons were sent back to their homes after completing administrative quarantine of 14 days. The government has set up 4 big quarantine centres in Kathua and Samba districts for housing those coming from different parts of the country to undergo mandatory 14-day quarantine period. Besides this, interstate movement of 34,000 trucks carrying essentials was also facilitated during lockdown. The government has also set up a dedicated helpline centre in JK Resident Commission, New Delhi, to facilitate the return of JK residents stranded outside the country. Nasir Rathar, AIR News, Jammu.
Uttar Pradesh Chief Minister Yogi Adityanath has appealed to the migrant workers of the state to have patience and avoid travelling by foot. Work of bringing back the labourers from Madhya Pradesh is in progress, and from tomorrow, migrant workers from Gujarat will also be brought back. UP government has written a letter to other state governments and sought details of migrant workers.
UP government has prepared elaborate plan for the return of lakhs of migrant workers from other states. Details like name, address, medical report and mobile numbers of those migrant workers who want to return to their native places have been asked from other state governments. Chief Minister Yogi Adityanath has said that his government is in touch with other state governments and discussing the ways to send migrant workers to their native places, and meanwhile, they should remain wherever they are right now. State government has started preparations to deal with the situation after return of migrant workers. Till now, arrangement of quarantine centers, shelter homes and community kitchen for 6 lakh persons are in place. Expansion of level 1, 2 and 3 hospitals is on card, and beds in COVID hospitals are also being increased to 52,000. Sushil Chandra Tiwari, AIR News, Lucknow.
Bihar government will draw a detailed action plan with regard to return of migrant workers and students. Deputy Chief Minister Sushil Kumar Modi said that the state government will look into the arrangement of transportation of stranded people based upon deliberations with respective governments. Mr. Modi said since the centre has not announced operations of trains, buses will be used for this purpose. State government will conduct screening of people coming to the border, and those showing any symptoms of infection will undergo through diagnosis and treatment. The Deputy Chief Minister said screening of stranded people returning to the state will be done at the block level as well. In Gujarat, the government today appointed nodal officers for various states to bring back stranded students, travellers, pilgrims and working professionals. The nodal officers will also ensure the smooth movement of people from other states who are currently stranded in Gujarat during the lockdown. The order has been issued as per the guidelines from the Ministry of Home to facilitate the movement of people between states.
The Maharashtra government, in a notification issued today, said migrant workers, pilgrims, tourists, students and other persons stranded in the state can leave for their homes within the state and to other states after following the procedural practices laid down by the government. More from our correspondent.
The Maharashtra government has set up a committee of 3 senior IAS officers who will coordinate with the movement of stranded persons. The notification states that no movement shall be permitted into the state of Maharashtra unless the group of persons has obtained a letter from the appropriate district collector or the director, State Disaster Management. Similarly, no group of persons shall be allowed to leave unless they have an appropriate letter from the receiving state district authority. It further says that any group of persons coming into Maharashtra will have to strictly follow the 14-day quarantine period, which will be ensured by the collectors, municipal commissioners. In another development, the return journey of about 1800 students stranded in Rajasthan's Kota has begun. Upon their arrival into the state, the students will undergo health checkup followed by the mandatory 14-day home quarantine. Meanwhile, Maharashtra government has directed all hospitals in the state not to turn away patients as complaints were piling up against several private hospitals and clinics for reportedly refusing to examine people. Kunal Shinde, AIR News, Mumbai.
Delhi government and city police are finalizing modalities for the movement of migrant workers and people of other states from the national capital. In a video message, Delhi police PRO MS Randhawa said Delhi police is in regular touch with resident commissioners of different states.
तमाम migrant laborers हैं और people stranded at different places हैं, उनको proper registration करवानी होगी ताकि जो उनकी movement है, उनके जो home places है, वहां तक की मूवमेंट को प्रॉपर रेगुलेट किया जा सके, तमाम जो प्रिकॉशंस हैं उनको फॉलो किया जा सके। तो इसके मद्देनजर मैं आपको अपील करना चाहूंगा कि आप जब तक इसका एसओपी नहीं बन जाता और आपके रजिस्ट्रेशन के बाद इसकी प्रॉपर मूवमेंट का प्लान नहीं बन जाता, तब तक आप किसी भी सोशल मीडिया पे अगर कोई पोस्ट आती है उस पर ध्यान ना दीजिए।
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi holds comprehensive meeting to discuss strategies to attract more foreign investments into the country. Health Ministry says recovery rate of COVID-19 cases has improved to about 25%. Doubling rate slows down to 11 days. Government says new guidelines to fight COVID-19 to come into effect from 4th of May with some relaxations to many districts. World Health Organization to convene an emergency meeting on coronavirus today, and Heavy Industries and Public Enterprises Minister Prakash Javadekar discusses the impact of COVID-19 on the automobile sector. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण। लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। DD 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
श्री महाभारत कथा।
Welcome back. You're listening to the special news program on COVID-19. Heavy Industries and Public Enterprises Minister Prakash Javadekar today discussed the impact of COVID-19 on the automobile sector with a group of select CEOs of the Indian automobile industry. During the meeting through video conference, Mr. Javadekar heard the suggestions from the industry on possible policy interventions to minimize the impact. The industry highlighted key issues with some suggestions related to reopening of the entire automotive industry value chain, support for dealerships, employment support interventions, boosting demand, and requirement for financial support. The minister assured the industry captains that his ministry will discuss all the suggestions and their demands with respective ministries.
They gave the scenario of the industry and importance of the industry. As everybody knows, it is mass employment generator. It's taxpayer also. Maximum GST comes from it. Then this has a contribution in GDP and manufacturing GDP and on all parameters and even in exports. So this industry is very important for India and we have to bring them back on the wheels. Overall, there were many discussions and many demands of GST cut, their employment support, retail chain support, supplier support, liquidity support.
India has approved 2.8 million hydroxychloroquine tablets as grant assistance to 25 countries. Briefing media today, External Affairs Ministry spokesperson Anurag Srivastav said India has also provided 1.9 million paracetamol tablets. In addition, consignments of hydroxychloroquine and paracetamol are being sent to 87 countries on a commercial basis. India continues to remain in touch with partner countries across the world as part of collaborative approach in dealing with the pandemic. During the last 1 week, Prime Minister Narendra Modi has spoken to Presidents of Indonesia and Prime Minister of Ireland, Singapore, Canada and Bangladesh. The Prime Minister also spoke to the State Councillor of Myanmar this afternoon. The World Health Organization (WHO) will convene an emergency meeting on coronavirus today. WHO Director General Tedros Adhanom Ghebreyesus informed this yesterday. Executive Director of the WHO Health Emergencies Programme, Michael Ryan, said he hopes that the much talked about drug remdesivir and other drugs prove helpful in COVID-19 treatment. WHO declared the COVID-19 outbreak a pandemic on March the 11th. According to the statistics collected by Johns Hopkins University, more than 3.15 million coronavirus cases have been recorded globally.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and myth-busters. The government has rejected claims that drinking methanol, ethanol or bleach prevents or cures COVID-19. In a tweet, Information and Broadcasting Ministry said doing so can be extremely dangerous. Methanol, ethanol and bleach are poisons and drinking them can lead to disability and death. These will not kill the virus in the body but cause harm to organs. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Amarchand Bajaj, Senior Consultant in Sitaram Bharti Institute of Science and Research, New Delhi, highlighted the need of social distancing to defeat novel coronavirus.
Don't try to leave your home. What is the lockdown that you should keep yourself under lock in your house. Before stepping out of your home, always think that is it really needed. The other thing is like you need to go buy for your daily needs things like grocery, meals or vegetables. Yes, you will need to go outside for that. So even if you need to go outside for all those, you will have to remember that try to keep as much as distance in between the two persons you're standing in the queue or wherever you are there outside your house.
Dr. Sarita Gulati, senior cardiologist in Manipal Hospital, New Delhi, said people should take care of their hygiene and other preventive measures to contain the spread of the novel coronavirus.
Most important is maintain social distancing, avoid crowding in crowded places, maintain personal hygiene, cover your nose and mouth while coughing and sneezing, wear mask. Any mask is good for use by public. Practice frequent hand washing with soap, water or alcohol-based sanitizers. Regularly clean your mobile phones, electronic items, keys and wallets.
In Himachal Pradesh, on the one hand, state government has made adequate supply of essential commodities to the people during the lockdown imposed in the wake of COVID-19. On the other hand, home delivery service of medicines is also being ensured for patients suffering from this severe illness. Our correspondent has more.
With this helpline service, thousands of patients in the state, especially kidney transplant, heart surgery, cancer and psychiatric patients are being provided medicines at their doorsteps. Through these helpline numbers, 1,059 medicines demands have been received, out of which 90% medicines have been made available to these patients with different ailments. These medicines have also been made available to the patients from outside the state. Apart from this, the state government has also provided medical assistance to about 250 students from Himachal stranded in Goa. In this time of crisis, the help is being provided by the state government to its people is truly commendable and shows the sensitivity of the government towards people. Sanjeev Sundariyal, AIR News, Shimla.
In Tamil Nadu, 161 more people have been tested positive for COVID-19, taking the total to 2,323. 138 of the new cases are in Chennai. 48 others have been discharged after recovery. Meanwhile, Chief Minister Edappadi Palaniswamy today consulted the medical and epidemiological experts reportedly to decide on the lockdown. More from our correspondent.
161 is one of the single largest count of new COVID-19 patients in a day in Tamil Nadu since the outbreak of the pandemic. The medical experts and epidemiologists who are part of the team formed by the state government to advise on the lockdown have favored relaxing the restrictions in a staggered manner after May 3rd rather than going for an outright opening up. They have also recommended making it mandatory for the doctors practicing privately also to wear personal protective equipment while treating their patients, as there is no way to distinguish between a normal fever case and a COVID-19 case. Jai Singh, AIR News, Chennai.
Bringing a sigh of relief to Kerala, only 2 COVID-19 positive cases were confirmed in the state today, with 14 persons having recovered. With this, the number of active cases in the state is reduced to 111. A total of 383 persons have been recovered so far. The state government has requested Centre to provide special non-stop train to send back the migrant labourers in the state to their home states as per Centre's order. There are over 360,000 migrant labourers in the state, mainly from West Bengal, Assam, Bihar and Uttar Pradesh. Karnataka state government has decided to allow industries located outside COVID-19 containment zones to open from May 4th. Addressing media persons in Bengaluru today after the cabinet meeting, Chief Minister B.S. Yediyurappa said that based on the guidelines issued by the central government, industries will be allowed to function in the state. The Chief Minister later in the day met industry bodies to seek feedback on the possibility of starting the industries. Mr. Yediyurappa also announced a 30 lakh rupees life cover for the frontline warriors. More from our correspondent.
The Federation of Karnataka Chamber of Commerce and Industry has asked the Chief Minister to provide interest-free loan, share 25% of labour costs during the lockdown period and allow easy payment of taxes and power bill. In the cabinet meeting today, it was decided to issue inter-district passes to the industry list to travel to their place of work. It was also decided to allow one-time interstate or inter-district movement of people and labourers stranded due to COVID-19 lockdown. Meanwhile, the novel coronavirus evening bulletin says that 30 new COVID positive cases were confirmed today. Leaving out 21 deaths and 229 charges, there are 314 active cases and out of which 9 are in ICU. The doubling rate in the state is 21.6 days. Sudhindra, AIR News, Bengaluru.
The first COVID-19 testing laboratory of Arunachal Pradesh was inaugurated by State Health Minister Alu Libang in Itanagar today. The lab is set up at the Tomo Riba Institute of Health and Medical Science, THRIMS, in Naharlagun, which is also one of the COVID-19 hospital of the state. As of now, there is no active COVID-19 positive cases in Arunachal Pradesh. The lone COVID-19 positive patient was discharged from hospital after testing negative.
About 7.5 crore people of the country have downloaded the Arogya Setu app so far and are using it as a preventive measure against COVID-19 pandemic. Talking to AIR News, one of the Arogya Setu app users from Giridih district of Jharkhand welcomed this initiative.
Sarita Jain, Makarpur Chowk, Giridih Nivasi. मैं आपको आरोग्य सेतु ऐप के बारे में बताना चाहती हूँ। भारत सरकार ने 130 करोड़ जनता की सुरक्षा के लिए इसे बनाया है। ये हमारा पर्सनल बॉडीगार्ड है। अगर हम किसी कोरोना संक्रमित व्यक्ति के संपर्क में आते हैं तो ये ऐप हमें इसकी जानकारी दे देता है, जिससे हम अपने परिवार की, अपने नगर की और अपने देश की सुरक्षा कर सकते हैं। मेरा आपसे विनम्र अनुरोध है कि आप आज और अभी इस ऐप को डाउनलोड करें। अपने परिवारजनों एवं अपने मित्रों को भी इसको डाउनलोड करने की प्रेरणा दें। घर में रहिए, सुरक्षित रहिए।
Legendary cricketer Sunil Gavaskar also appealed to people to follow the social distancing to stay safe.
Please maintain personal hygiene, avoid gathering in places, because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. Believe me, that's the hardest thing for me myself, because I am on a plane every third or fourth day. So please try and avoid unnecessary travel.
The University Grants Commission UGC has released guidelines on examinations and academic calendar for the universities in view of COVID-19 pandemic and lockdown. The academic session 2020-21 may commence from 1st of August for old students and from 1st of September for fresh students. Intermediate semester students will be graded based on internal assessment of the present and previous semester. In states where COVID-19 situation has normalized, there will be exams in July. For terminal semester students, exams will be held in July. A class 10th student from Kendriya Vidyalaya, Rameshwaram in Tamil Nadu has appreciated the commencement of online classes. The classes take place from 9 a.m. to 2:30 p.m. and have been started so that the academic calendar does not suffer due to COVID-19 outbreak.
Soumya of class 10th, studying in Kendriya Vidyalaya, Rameshwaram. Due to this coronavirus, our schools has not been opened. From April month onwards, our school has started online classes. Because of the online classes, we are able to continue our studies. For these online classes, there is a certain timetable for this. From 9 a.m. to 2:30 p.m., we have been studying continuously. We will mark down our doubts. Our teachers will clear our doubts through videos.
Road Transport and Highways and MSME Minister Nitin Gadkari has said that Ayush practices of India have a big potential to help the country become an economic superpower. He called for greater research and innovation which will help in further growth of the Ayush sector. Mr. Gadkari was speaking while launching the Ayush Entrepreneurship Development Program jointly organized by the Ministry of Ayush and Ministry of Micro, Small and Medium Enterprises for promoting Ayush in the country. The last rites of veteran Bollywood actor Rishi Kapoor were performed with full state honours at the Chandanwadi Crematorium in Mumbai today. The actor was cremated in the presence of his wife Neetu Kapoor, actor son Ranbir Kapoor, along with other dignitaries from the Hindi film industry, including Abhishek Bachchan, Saif Ali Khan, Kareena Kapoor and others. The 67-year-old actor passed away this morning after he was admitted to a private hospital yesterday following health issues. Earlier, he had returned to India last September after undergoing treatment for cancer in the US for almost a year. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1800115767. You can also ask questions on the telephone number 011-231-4444. I repeat 011-231-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for regular updates. Scientists at the S.N. Bose National Centre for Basic Sciences, Kolkata, have developed a safe and cost-effective nanomedicine that promises treatment of a number of diseases by altering oxidative stress in the body. The research may provide a ray of hope in India's fight against COVID-19 as the nanomedicine can decrease or increase reactive oxygen species in the body depending on the situation and cure the disease. In a trial on mice, the nanomedicine was found safe and swift, precisely bringing down bilirubin levels within 2.5 hours. And now, before we end, here are the headlines once again. Prime Minister Narendra Modi holds comprehensive meeting to discuss the strategies to attract more foreign investments into the country. Health Ministry says recovery rate of COVID-19 cases has improved to above 25%. Doubling rate slows down to 11 days. Government says new guidelines to fight COVID-19 to come into effect from 4th of May with some relaxations in many districts. World Health Organization to convene an emergency meeting on coronavirus today. And Heavy Industries and Public Enterprises Minister Prakash Javadekar discusses the impact of COVID-19 on the automobile sector. And with that, we end the special news program on COVID-19.